And stations coming up on 90 seconds until the launch of hour number 1 of The Line of Fire with Dr. Michael Brown. Salem Radio Network's channel SR2. 90 seconds from Mark. 90 seconds. And stations, it's now 1 minute before the start of hour number 1 of The Line of Fire with Dr. Michael Brown. 1 minute from Mark. 1 minute. And stations now the final time check before the start of hour number 1 of The Line of Fire with Dr. Michael Brown. 30 seconds until hour number 1 from Mark. That was our final verbal time check for The Line of Fire with Dr. Michael Brown. We'll have a long tone at 10 seconds before, followed by a short one at 5 seconds. Have a great afternoon, everybody.
You've got health-related questions. We've got health-related answers with Dr. Stengler today.
It's time for The Line of Fire with your host, biblical scholar and cultural commentator, Dr. Michael Brown. Your voice for moral sanity and spiritual clarity. Call 866-34-TRUTH to get on The Line of Fire. And now, here's your host, Dr. Michael Brown.
Thanks for joining us, friends, today on The Line of Fire. This is Michael Brown coming your way live from our studio in Fort Worth, Texas at Mercy Culture. I just finished teaching the students at the Spiritual Leadership School. Great time with them. Thrilled to be with you today. We haven't done this in a few months, so we wanted to bring my friend, colleague, and Dr. Mark Stengler back on the air on a Friday. Any health-related question you have of any kind, something you're going through, something with a family member, something you've wanted to ask, get to the truth about things you've heard, phone lines are open. 866-348-7884. It's a great opportunity to call in. Before we get to any calls, Mark, great to have you back on the air. Thanks so much for joining us.
Hey, Michael, great to be back with you today.
What do you, I know there's more time in the day. You're on the West Coast, so 3 hours behind us, or 2 hours behind where I am right now, 3 hours behind East Coast. But what do you normally do on Fridays?
Well, I work really hard at the clinic Monday to Thursday, and then most mornings it starts off the same way. I get up, I do some Bible study, some apologetics study, then I do my exercise, have my morning shake, and then usually some other clinic stuff comes up, and then I work on some of my writings for my website and books and things like that. So usually around Friday, 2 o'clock, I'm pretty much done, and I get ready for Saturday, which is a big evangelism day for me, kind of like people have their sports day. Saturday, sometimes Sundays, one of those 2 days is my evangelism day, so I start kind of getting prepared for that as well.
Interesting. So the evangelism, you go out in the park where people come through, share the gospel, or you share the gospel in front of mosques, things like that?
Yeah, exactly. Saturday, usually it's Saturday or Sunday. Usually it's Saturday. I'm at the park most of the day with a group of men, some women, and we're doing evangelism. Apologetics is involved with that too. We do some separate events at mosques between San Diego and Los Angeles, where we meet up and talk to people after their services. We kind of wait outside on the sidewalks. We're not being, seen as being rude or obtrusive, and then we have outreach that way too.
Got it. Very interesting. Yeah, I just love that side of you, going out, sharing the gospel on a regular basis. Okay, before we get to any calls, a lot of people, I realize, when I mention you're a naturopathic doctor, they don't know what that means. They think it's someone without medical training using crystals or something like that. So we did this a long time ago, but I want to just do it again because I'm familiar with your background and your writings and how your work is respected. But compare for me the training that you went through to get your medical degree to compared to what a traditional American doctor would do.
Yeah, no problem. I mean, there's two terms for licensed doctors in my field. You have naturopathic doctor or naturopathic medical doctor. I use naturopathic medical doctor here in California. And so basically, we're trained as primary care physicians. So if you think of your family physician, that's how we're trained. So, like all the other doctors, you got to get your bachelor's degree, and then you got to get accepted into a medical program. And there are certain medical schools where basically you learn integrative medicine. And what that is, you learn all the standard stuff people are familiar with. Doing exams, using lab tests, pharmaceutical medications, minor surgery, those types of things. And then integrated along with that, you're trained more heavily in nutrition, nutritional supplements, herbal medicine, intravenous nutrient therapy, bioidentical hormone replacement, spinal manipulation, things of this nature. And so basically, you're trained in both types of system, and we have a lot of flexibility. What we try to do whenever possible is treat people nutritionally or as naturally as possible, but we also use modern technology. We use lab tests. We actually usually use more lab tests than the typical doctor to find out what's going on inside the body at the root level or root causes, and so we can address that better. But if the patient needs medications, then we certainly use them. For example, with this COVID, I think I've prescribed steroids more in the last 6 weeks with this recent upswing than I have in years for people, lung issues, major body inflammation, antibiotics when needed. Obviously, ivermectin, I've talked about prescribing that. So, so we use medications when necessary. We use specialists when necessary. If a patient comes in and maybe they're diagnosed with I diagnose them with an EKG of a certain heart condition, let's say atrial fibrillation, or, maybe there's suspicion, maybe they had some heart damage, then I refer them to one of the cardiologists I work with. There's about 4 cardiologists I work with very closely. If someone has some other type of thing where they need specialty care, to a psychiatrist, to a gynecologist, whatever, we make those referrals and continue to work with the patient. So it's really an integration of both types of systems, which, the American public is very much resonating with, because we have found the hard way over several decades that a drug surgery-driven medical approach is insufficient to prevent disease, to successfully treat, especially chronic disease. And so this model is, becoming somewhat mainstream.
And in point of fact, if you went to your average doctor, they haven't been trained a lot in nutrition, right? So let's say someone has high blood pressure, maybe they're not, really obese or something like that. It's possible that the first solution the doctor would give is medication, as opposed to really looking into that person's diet and those habits that may be causing the high blood pressure. So they're treating the symptom rather than treating the cause.
Yeah, that's true. Modern medicine does acknowledge diet and lifestyle as major factors in terms of most chronic disease. The problem is the medical model, doctors aren't well trained in nutritional medicine. It's just a fact. Most medical, programs maybe have a course in nutrition, which is very insufficient. So that is true. You can pretty much go down the list of most chronic diseases, and they're at least in part, in some cases, much more than that, nutrition imbalances. A problem with the diet, nutritional deficiencies, lifestyle factors, exercise, stress reduction. Almost all the chronic diseases, you can make a strong case, the scientific evidence. These factors are involved, but, we're kind of this quick fix, give a prescription, mentality. And, there's places for that. But, look, America, with all our resources, with our phenomenal medical training, we're not doing well in terms of other countries in chronic disease. We're actually doing horrible. And so the reason for that is when you look at drug therapies and surgery, and while we need them and are phenomenal for acute problems, they are really insufficient for chronic disease. And so chronic disease is not well managed in America. And look, we know most chronic diseases, at least in part, and some more than others, when you look at the big ones like obviously obesity, when you look at diabetes, arthritis, for example, heart disease, all these types of big conditions affecting a lot of Americans, at the foundation is diet and lifestyle and stress problems. And so when those aren't addressed as the root causes, these diseases continue to flourish and affect more people. I mean, look, 50% of American adults approximately have prediabetes or diabetes. Now, that's not a drug deficiency. That is a diet and lifestyle fundamental problem. And so, you can see when you have conditions like obesity and diabetes, it's well acknowledged in all of medicine that your risk of heart disease, your risk of Alzheimer's disease, joint destruction from the extra weight, autoimmune disease, all these things skyrocket, and so that you develop other problems from the foundation of diet, exercise, lifestyle factors.
Got it. And that's how you and I actually connected. I was speaking at an apologetics conference at the church we're a part of, and there was a different person basically hosting me each day and getting me foods and things. And you said, yeah, you're not the only one that eats like this. And that's how we first started talking, and then found our common interest in apologetics and other things. All right, let's get to some calls. Again, friends, today, as we have Dr. Stengler as our guest, it's your opportunity to call in and get his opinion. Where you normally, how far booked are you at your integrative clinic? Is it weeks?
Yeah. For me, usually takes about, for the new patient, usually takes like around 6 weeks to be on a waiting list to get in.
Got it. So this is a busy clinic. You get to call in right now, 866-348-7884. We'll start with Vicki in Winston-Salem. What's your question for Dr. Stengler?
Hi, Dr. Stengler. I have had hair loss right in around my temple area, and it's bilateral, and I can tell that it's continuing. I'm continuing to lose hair, and I was just wondering whether it could possibly be due to the medication I take. I'm on Synthroid and Lotrel. I did go to a dermatologist. She gave me steroid injections and topical steroids. Then she wanted to start me on Prascar. I did not start the Prascar, so just, thought I'd call and ask.
Yeah, if I could ask one question. How long has it been going on for, and was there anything new going on right before it started? Like, had you just started these medications? Did you have an illness, high stress, anything like that before the onset?
Well, I've been on the medication been on Synthroid for about 25 years, and I've been on Lotrel for about 15 years.
Okay, and how long have you had the hair loss for, did you say? Yeah, how long have you had the hair loss for?
I noticed the hair loss probably about maybe 20 years ago. I started, and I thought it was due to I had a relaxer on my hair, and I thought it, like, the hair follicles may have gotten damaged on the sides because she put it on, in my hair when I had just come back from the gym, so my scalp was wet. And so I thought I may just have, some damage to my hair follicles, but then I noticed that it's become progressive, that, is slowly going into, more areas. And the left side used to
Tell you
not
what,
have any
we'll just stop here. Vicki, we come back, we'll be on with Dr. Stengler. Now's a good time to call in. We've got a line open. We'll get to as many calls as we can. Stay right here. It's a question I get all the time on the radio broadcast. What happens when you die? Where do believers go when they die? Now, there are Christians, followers of Jesus, born-again believers, who believe in what's called soul sleep. That when you die, it's like sleep. And that's why it's referred to as sleep in the New Testament. And when you next open your eyes, so the first thing, you close your eyes and open. If you've ever had surgery, you go under the anesthesia, and then you wake up, and that's the next thing you know. So that's how some believe it will happen. You close your eyes in death, you open your eyes at the resurrection with the Lord. So there's no consciousness in between. As much as I understand where people come from with that and the scriptures they use to support it, and the fact that it is not a heretical position, I still don't believe it's biblical for many reasons and a number of verses. But Paul writes this in 2 Corinthians chapter 5, verse 1. He says, "For we know that if the earthly tent we live in is destroyed, we have a building from God, an eternal house in heaven, not built by human hands." And he goes on to explain that to be absent from the body is to be present with the Lord. Paul refers to that in Philippians 1, where he says that he's ready to die as a martyr. And he said, I'm ready to depart and be with Jesus. That would be far better. So I'm going to leave this world and be with Jesus. It's what Jesus said to the thief on the cross once he professed faith, recognized who he was. "Truly I say to you, today you'll be with me in paradise." Even the picture of the believers, the martyrs before the throne of God in Revelation 6, the souls that cry out to God, would speak of them being God's presence. Now what we're ultimately waiting for is the second coming and the resurrection. That is the great goal. But as best as I understand it, the moment you leave this world as a believer, you immediately go into the presence of God. Yes, awaiting the resurrection, but as a spirit in his presence.
It's The Line of Fire with your host, Dr. Michael Brown. Get on The Line of Fire by calling 866-34-TRUTH. Here again is Dr. Michael Brown.
All right, friends, just want to make a very special announcement before we get back to our calls with Dr. Stengler. I want to encourage you right now, go to vitaminmission.com. Vitaminmission.com. Today, there is a special offer. I believe it's going to run a few days through the weekend into early next week. So take advantage of this. Tell your friends. Spread the word. If you use the code HEALTH, capital H, the word HEALTH, today you will get a 20% discount on all of Dr. Stengler's health supplements. Anything on the website, all the supplements. I've been taking them regularly. They're wonderful. They're high quality. They work. They're well researched. So normally you can get a 10% discount because of our partnership. But today, spread the word. Tell your friends. If you're a pastor, tell your church. You want people to get healthy. Supplement this with a healthy lifestyle. These things could really be the difference makers for many of you. So vitaminmission.com, and the code that you use, spread the word. Tell your friends. It's only for a few days. Health with a capital H. Got it? Take advantage of this. And then with every order, Dr. Stengler turns around and gives a donation to our ministry to help us reach more people. So we are blessed with all of this. Okay, Dr. Stengler, back to you. Words for Vicky, what would you say?
Yeah, just for Vicky, I mean, the medications she's on aren't typically known to cause hair loss. I don't think it's likely. That's the problem. It's not really clear, to be honest. Your doctor did recommend Proscar, which blocks a hormone known as dihydrotestosterone, which can lead to hair loss. For our patients, we don't, if possible, we don't like to have people take those kinds of medications internally because you're affecting other hormone balance in the body. Actually, that medication, we prescribe the patients topically. You can, your doctor could prescribe it from a compounding pharmacy in a topical cream form that can be applied to the scalp. We prefer that. We think, then, based on that, it'd be less, internal imbalance being caused. Number two, some of our patients, they get really good results with our hair collagen, hair, skin, and nails formula. You can look on the website about that. And third, there's a newer technology we also recommend to patients you could look into, and it's called PRP. It stands for platelet-rich plasma. And basically what happens is the doctor draws your blood, it gets spun down, the growth factors from your blood then are injected into your scalp, of course, with anesthetic, to stimulate new hair growth, hair follicles to be producing. So that's some of the newer technology we're seeing decent results with, and some things for you to consider.
Excellent. Hey, thank you so much for the call, Vicky, and for the advice, Dr. Stengler. What was the supplement that you recommended that others can look at who are having hair loss related issues?
Yeah, vitaminmission.com. It's called Collagen Hair, Skin, and Nails. It's basically nutrients that promote, hair health, skin health, and nail health. A lot of them cross over into the same tissues.
Got it. Okay, let's go to the phones with Deb in Bootstrap, Texas. Welcome to the Line of Fire.
Hi, shalom, Dr. Brown. Bastrop, Texas. Shalom to you and Dr. Stengler. First and foremost, thank you for your faithfulness to serve God and to serve us. Appreciate you.
Our joy.
My question, thank you. Dr. Stengler, when you first partnered with Dr. Brown, we invested in some of your products, but my question has to do with a Crohn's disease diagnosis about 20 years ago. And when I presented, they hit it pretty hard with some steroids, some other things, some Remicade infusions. And after about a year and a half, it seemed like the treatment was worse than the symptoms. And I got caught up in what you've described sort of as, that it's worse, it's bad, it's going to get worse, you're going to die from it, you can't do anything about it. And so when I tried to get weaned off of everything, they were resistant, and I ended up weaning myself off. And for about 20 years, I've been symptomatic, free, no symptoms. And that's how I'd like to actually handle the disease. We invested in some of your digestive wellness and your flora things and that sort of thing. Very, very recently, though, within the last week, I was doing some research again, and I found products that talk about prebiotics, probiotics, and also something called postbiotics. And I've come to understand that the gut biome is really important in Crohn's disease, and I wanted to know your opinion about that, and if you have an idea about Crohn's treatment as a whole through diet, through exercise, through monitoring, instead of just being loaded up on all sorts of medications and that sort of thing. So I guess your input or your take on that is what I'd be interested in hearing about.
Yeah, no, I'm very familiar with Crohn's disease. I've made patients with it over the years. And, it's some of those cases, we treat them combined with conventional medicine. Other patients, we're able to treat them just solely with natural medicine alone. So it kind of depends on the case. Maybe just a few things I've seen over the 27 years of practice. There can be different causes for different people. With Crohn's disease, what we tend to look at more in depth, is there an undiagnosed infection? That's one of the theories as to why some people continue to have problems with Crohn's disease, undiagnosed infection. So we use more of a modern technology of stool testing where we're looking for DNA fragments, say a parasite, bacteria, things which should not be in there, creating an inflammatory response. And that doesn't mean you have the problem with it, but that's one thing, we look at. Number two, food allergies, or probably a better word would be food sensitivities. It's certainly possible you have food sensitivities delayed, which you're not aware of, and there's ways, doctors in this field could test you to kind of help pinpoint maybe what's irritating, contributing to the problem. And number three, and I'm actually finishing an ebook on this right now, but the whole idea of what's called leaky gut syndrome, which is increased intestinal permeability, so an unhealthy lining of the small intestine, where most of your immune system resides, actually, creating a lot of the inflammatory reaction you get with inflammatory bowel disease. And that ties into what you're talking about, the microbiome. So certainly many studies have shown people with Crohn's disease, virtually all of them definitely have an imbalance in their microbiome, an imbalance, overgrowth of bacteria that shouldn't be there, or fungi, as well as not levels of good bacteria. So answering your questions, yes, we want patients to get in prebiotic foods which feed the good flora, foods people may not think about, but basically it's going to go down to fruits and vegetables. There's ones within those categories which work better than others, like who would ever know that the inulin, a component of fiber you find in artichokes, is one of the best prebiotic foods you can eat to feed your good bacteria. Probiotics you find obviously in foods like yogurt, but when you have conditions like Crohn's disease, most of these patients don't tolerate dairy products, and so you can use things like coconut yogurt, for example. And then postbiotics are when you get the good bacteria in, and these are metabolites which fight off bad bugs, supply good fatty acids to your digestive tract. That can be good. In our products, actually, one of the main products I use is the LO-DGL glutamine powder. The LO and DGL is very healing, anti-inflammatory to the lining of the small intestine as well as the colon. Of course, Crohn's disease can go from the mouth to the anus, so it actually helps with the whole alimentary tract. So we have people use that always when they have those conditions. But then we're trying to work more at the root problem. Most people with Crohn's disease, we find they have, gluten allergy, dairy allergy. We want to support the digestion, kind of like you're doing, and then use those anti-inflammatory herbs like I talked about, along with high-dose fish oil is used a lot in Crohn's disease. So those are some of the things, and like I said, also looking at maybe undiagnosed infections. If a patient's not doing well, we recommend for a period of time getting intravenous nutrients to supply the nutrients to the body so you don't get so weak, so your GI tract can heal as well. And the last thing we use a lot with patients is our inflam fighter powder. It's actually specific to the digestive tract, inflammation of the digestive tract. It has a hypoallergenic protein in it, anti-inflammatory compounds. We almost always use that as well until the patient's doing better. So those are just, some things to consider.
Awesome. Thank you so much, Dr. Stengler. Thanks for the call, Deb. 866-348-7884. You may want to call a friend who's been struggling and can't seem to get answers from a doctor and don't know what's going on. Great time to call in and get some professional advice. Dr. Stengler, we've just got a short time before break, then we'll get back to our calls. But we're often used to instant results with medicine that we take dealing with some of the symptoms. But when you're dealing with a lifestyle change or you're dealing with adding in healthy supplements, it's only going to take a little while before you see the results of these, correct?
Yeah, it just really depends on the person and their state of health. I mean, the longer someone's been sick for, then yes, you should give it more time to see how they're responding. Someone who's in generally good health, though, maybe has more of a mild to moderate health problem, with the right treatment, some people can notice difference within days to a week or two. So it just depends. It's like that in regular medicine, too. The longer someone's had a condition, the longer you got to kind of give the time to see how they're responding. Right. Yeah.
Got it. Yeah, I just know sometimes we're always looking to snap our fingers. I remember when I radically changed my lifestyle with God's help back in 2014, August of 2014, I was surprised maybe 6 weeks in I got a cold. I thought my immune system was going to be like invincible. Well, it took a while to get stronger, and it got much stronger over the years. Hey, friends, we're going to be back with Dr. Mark Stengler. It's a real privilege to have him on with us, and you get to call in and ask your questions for yourself or for someone else. And as you can see, he has a wealth of knowledge and is doing his best to work with God and the human body to help people get well. Remember, visit vitaminmission.com. When you go there today through early next week, so take advantage of this, you want to use the health code, capital HEALTH. When you put that in with any order, if you're subscribing, you want to take advantage of this, 20% off your orders that are placed today through early next week. So spread the word. They're great health supplements. This is a great way to get them. And then funds come back to help with our ministry as well. So everyone's blessed in the process. And we really believe these will contribute, along with lifestyle changes, to really get you healthy. We're here to see you healthy, spirit, mind, and body. We'll be right back. When I came to faith as a heroin-shooting, LSD-using hippie rock drummer at the age of 16 in 1971, I didn't know what apologetics was. And for some years after that, I did not hear the term apologetics, and if I heard it, I thought it was some type of apologizing for the faith. So I want to assume I'm not the only one that made that same mistake and somehow thought apologetics was apologizing for what we believe or some sign of weakness. No, the concept comes directly from Scripture. The Greek word apologia is a defense, is an answer. So if you were defending yourself in court, false charges come. Here's my apologia. Here's my answer. Here's my defense. And the most famous usage of this is in 1 Peter chapter 3, verse 15, where Peter says, in your hearts, revere Christ as Lord, and always be prepared to give an apologia, an answer to everyone who asks you to give the reason for the hope that you have, but do this with gentleness and respect. Always be prepared to give an apologia, to give an answer, to give a defense. Paul speaks in Philippians 1 about being in jail, being persecuted for the defense of the gospel. Here's what we have to understand. Apologetics serves two major purposes. Obviously here, 1 Peter 3, we want to have an answer. Why do you believe that? That's crazy. Nobody believes that. Nobody believes the Bible. Nobody. That's contrary to science, contrary to reason, contrary to morality, whatever it is. There are many religions. There are many ways to God. There's no way we would believe that. We need to have an answer to help the non-believer. And if we can't answer their questions, why do you think they're going to listen to the rest of the message? Well, Jesus changed me. You're just going to have to believe me. So I talked to a Muslim, and he talked about being changed. I talked to somebody who came back to Judaism. She talked about being changed. I talked to this Hindu, and he seems devout. It's like, why should I listen to you? Well, I know. No, we have to do better to engage someone's mind to get them to stop and listen long enough to then hear the rest of the message so it can be pre-evangelism or preparing the way for the rest of the message. But also, apologetics is super important because it builds up believers in the faith. I had to pull myself up on my own bootstraps, bombarded by rabbis and Orthodox Jews and objections and counter-missionaries as a new believer, not even knowing Hebrew then. I had to study and learn. The reason I wrote a 5-volume series on answering Jewish objections to Jesus and endless hours of apologetics since then was so that no other Jewish believer would have to go through what I went through, that they would have the answers ready. And I've run into many who said, Dr. Brown, I'm in the faith today because of you, meaning I was a believer. I was falling away with questions. I read the answers and it strengthened me. Let us strengthen the believers so that we know we have answers, and then we can go to the world and give the world those solid answers. Apologetics is crucial, important, especially in this day and age.
Not for God podcast with Mike Zwick.
It's The Line of Fire with your host, Dr. Michael Brown. Get on The Line of Fire by calling 866-34-TRUTH. Here again is Dr. Michael Brown.
Thanks for joining us, friends, on the special Friday edition of The Line of Fire. We're talking with my friend, colleague, and Dr. Mark Stengler, and he's answering your health-related questions. This is a wonderful time to call in 866-348-7884 for yourself, for a family member, for a friend, or it can be not personal health, but something you're trying to sort out. You read one thing, you read another thing, you read this is recommended, that's recommended. How do you sort these things out? We could even take COVID-related questions. Thankfully, hopefully, these will continue to wane, but you may have a COVID-related question. 866-34-TRUTH. Before we go back to the phones, I just want to ask Dr. Stengler a couple quick questions. I had seen another doctor specializes in nutritional things, and he was saying, you don't want to take this, you don't want to have this in vitamins. He's giving a list of things, and my wife Nancy's the one really familiar with nutritional issues. I just do as told, okay, this is healthy, this is not, whatever. I don't know the reasons for it. But there is something saying don't use folic acid, and I don't know the background to that. Is that ever used as an ingredient in vitamins or supplements? What are the pros, cons with using it?
Yeah, good question. Actually, I had an article, I guess people Google searched it. I had an article published in a medical journal on this topic in terms of folic acid, folate, and depression. But folic acid, interestingly, it's referred to as a B vitamin, but it's man-made. It's synthetic. You do not find it in food. You don't find it in nature. So it's very cheap and inexpensive to make. So if you look at, say, a multivitamin or a B complex that has folic acid, typically it's going to be a lower cost, kind of non-professional item. So holistic doctors like myself, we always use formulas which have folate or methylfolate. That's what you find in foods like, say, green leafy vegetables. And so the human body is designed to obviously interact with natural folate. Folic acid, again, synthetic. You don't find it in nature. And so about 45% of the population, they have what we call a genetic variation, and it's called the MTHFR gene. We have a couple different locations for MTHFR in our genes, but basically about 45% of people have a variation where they do not metabolize folic acid very well. And like I said, folate is very important because it's involved in normal cell division, it's involved in metabolizing hormones, it's also involved in making neurotransmitters. That's why there's several studies showing that folate can help with depression because it helps you make serotonin. But if you have this genetic variation, then you can't get folic acid into its final form. So when you take folic acid as a supplement, it has to go through some different conversions to get into its active form in your cells. And so a fair amount of people genetically have problems doing that. And so if you're using the natural form, like the methylfolate found in foods, then you already have it in its active form, so your cells can utilize it for all the cell processes. So there is something to that. That is true.
Got it. Okay. And then, I'll tell you what, I'll get to my other question. Want to get to our callers first. My other question can wait. Let's go over to Claire in Centerville, Virginia. Welcome to the Line of Fire.
Hi, thank you for taking my call.
You're welcome.
Can you hear me?
Yes, go ahead.
Okay, yes, I would like to find a more natural doctor. I've been looking for one, but when I look, it seems like they're involved in like acupuncture and different things that I've always thought were new age, and I was wondering what you think of that, and how do you recommend looking for a natural doctor as a Christian?
Yeah, I mean, it's a good question. I mean, in terms of the field of what we call integrative medicine, holistic medicine, in terms of doctors, I mean, there are about 20,000 of us around the country, and it's growing actually very rapidly. In terms of the number that are Christian, yeah, it does tend to be a smaller percent. That is true. Some doctors are into kind of new age medicine type stuff. So honestly, you just have to Google like integrative doctor and see what comes up in your area, and then just look at their bio or call their clinic and kind of see what they're into. That's about the only way to do it. There are some national kind of associations like A4M, A, the number 4 and then M, and that lists integrative medical doctors like myself around the country. That's one resource people can do. In terms of acupuncture, I mean, there's different thoughts on it. I mean, when I started in this field, maybe like I've been practicing 27 years. There's a small percent of people that use acupuncture. They're into some strange stuff. I mean, most of the people I know that use acupuncture totally use it from a medical model. They just see it as improving circulation, blocking pain signals. They don't get into the Chinese philosophy and some of the spiritual aspects of it. I know Christians kind of have different thoughts on it. I do have an osteopathic doctor in my clinic who does do some acupuncture, and he's a very dedicated Christian and would reject all other forms of theology for sure. So different thoughts on that, but nevertheless, I think that's just the best way to do it. Just type in integrative doctor, type in holistic doctor, see who comes up in the area, and then you're just going to have to kind of see what their bio is or ask their clinic. Or hopefully you can get maybe a referral from someone in your church, that has a good experience and knowledge of somebody.
Yeah, and I think a lot of it, Mark, has to do with different parts of the country. Different parts of the country seem to be much more aware. I had to get a particular shot I'd gotten at your clinic for a hand condition, and the only place I could get it was someone doing acupuncture. And I had to go just to the state immediately south of me. And the person, I live in North Carolina, just have to drive like 45 minutes into South Carolina. And this doctor was trained in Chinese medicine, not into the spiritual side of it at all. But the doctor was telling me, I have to go to South Carolina because I can't practice in North Carolina. And then when you had called in a prescription for me, to our mutual shock, we found out that they don't fill prescriptions from integrative doctors in North Carolina. And when I asked the woman in South Carolina about it with the Chinese medical background, she said to me, it's basically, bureaucrat. It's just somebody in charge making the decisions. And she would say that certain parts of the country are way ahead of other parts of the country. So, yeah, very interesting. Hey, thank you. Thank you. Yeah.
That's true, Michael. But one thing is, I mean, basically, but every major city in America, and I don't, it depends where someone lives. It's very rural and there's not a major city nearby. It's a problem. But every major city in America has integrative doctors. I mean, it's been my experience.
Yep. Yeah, absolutely. It's just the mentality, the philosophy. It's so interesting. This woman who had been trained in Chinese medicine made an interesting comment. She said, Western medicine is really good for emergencies. Someone's been in an accident, it's life and death, get them back. But in terms of long-term health, when you go in to see whatever your condition is, she spends like an hour with you discussing your diet and lifestyle first. So it's just such a different mentality. Just interesting to talk about what did you learn, how did you learn, not the spiritual stuff, forget that, but just the different approaches to Chinese science. So when you do your health research, you're looking at studies from around the world, as any good doctor would do, and you're looking at different results, China versus Europe versus America, and that's how you put everything together, correct?
Yeah, and I've been trained in analyzing statistics and stuff and studies, no matter where they come from. So I take that into account. But yeah, I don't have a bias in terms of a study doesn't have to come out of America to be credible. So yeah, I actually look at a diverse amount of different sources. Some are more holistic in nature. I actually look at a lot of very mainstream. I've been writing this ebook on leaky gut syndrome or intestinal permeability, and I have over 45 references that come from mainstream medical journals supporting the concept of how common leaky gut syndrome is. We have malabsorption of the small intestine, how it contributes and makes one susceptible to all sorts of different health conditions. So I kind of like that because, some people take that more serious than, say, maybe some unknown, holistic journal or something. So I actually rely on that quite heavily.
Got it. All right, let us go back to the phones and let's talk to Bert in Greenville. Excuse me. Yeah, in Greenville, South Carolina. Welcome to the Line of Fire.
Thank you, Dr. Brown. Good to speak with you. I appreciate your show. And Dr. Stengler, I also listen to him often on another radio program. My question is about extra virgin olive oil. I buy cold-pressed extra virgin olive oil and believe it's healthy for you when it's in its raw state. When you cook with it, is it only good because it's worse than other saturated fat or other fats, or is it actually good for you after you've heated it, olive oil?
Yeah, olive oil, of course, has tremendous studies on it in terms of cardiovascular disease, showing to reduce blood pressure, reduce risk of heart disease, it's high in antioxidants. It's singled out as one of the key items why the Mediterranean diet has been the most well-studied, successful diet in the world. Olive oil, high amounts of it. High amounts have been shown also to reduce the risk of breast cancer in women. So it's a very powerful food. Food is medicine. The only problem with olive oil, it does not tolerate a high heat when you cook with it. You're not really supposed to cook with it at high heat because it oxidizes too easily. So you can use it in cooking, and you should, but you do not want to put it at high heat. It has to be at a lower heat. And of course, as I'm sure you do, as you're doing, you can obviously add it to salads and stuff without heating it. So, but it is definitely a super food.
All right. Thank you, Ben, for the call. 866-34-TRUTH. There was a caller who ended up not coming on the air, Mark, and he was asking questions about mental health. Obviously, this is complex, and mental health can have endless numbers of explanations, and that's what I know about it. You're an expert in wide ranges of medical issues. But generally speaking, we've been talking about diet, lifestyle affecting the body, chronic diseases, things like that. What about diet and lifestyle affecting our emotional state in general? So we're not saying all mental health issues, but in general, how do diet and lifestyle impact how we feel mentally, emotionally, how we function, brain health, things like that?
Yeah, that's been studied. There's definitely a direct connection for a lot of people, how their diet and lifestyle is, compared to if they're, afflicted by, say, anxiety and depression. So when we see patients, maybe, they have just started to have anxiety or depression, we certainly want to work with the diet, getting more of a whole foods diet in, make them more resistant to stress. With that, we need to get them not overdoing the stimulants, like too much, caffeine, for example, alcohol. Creates imbalances in the brain, causes brain inflammation, making sure they're getting the omega fatty acids in their diet. Our brain is 60% fat, so there's been several studies showing that when people are low in omega-3 fatty acids, like in cold water fish, maybe things like walnuts, for example, people are more prone to anxiety and depression. This has been studied. The brain's like any other organ. It doesn't work by magic. It does have to have the right nutrients and nutrition to work. And so, it's just like a car. You put gas in, it'll work. If you don't put the gas in, it won't work.
Got it. All right, we'll be right back. I want to talk to Dr. Stengler about ivermectin, about a quercetin supplement, and we'll take some more of your calls as well. Stay right here. someone once said the problem with deception is that it's very deceiving. And we can deceive ourselves as easily as we can deceive someone else. In fact, James, in the first chapter of his book, warns us against self-deception. And there's an interesting passage in Matthew 23, the 30th verse, when Jesus is speaking to religious hypocrites, religious leaders who are hypocritical, that they would say of themselves, if we had lived in the days of our fathers, we would not have taken part with them in shedding the blood of the prophets. And here, they're about to shed the blood of Jesus by giving him over to the Romans to be killed. So, you see the point of it. We can be righteous in our own eyes. Oh, slavery is so evil and slavery is so terrible. We've never participated in it, and yet we participate in abortion. Or, oh, if I had lived then, if I lived in Nazi Germany, I would have stood up for the Jews. Oh yeah, and we live here in America, and we're afraid to stand up so unless we lose our likes on Facebook. It's very easy to self-deceive. It's very easy to look at ourselves in ways that are unrealistic, which means we can't rely on ourselves alone to measure whether we're deceived or not. We need accountable relationships and people who can speak the truth to us. And then above all, we need to be on our faces before God saying, search me, cleanse me. Lord, reveal hypocrisy in me. Reveal deception in me. You know, when I teach about sexual purity, one of the first points I make is anybody can fall into sexual sin. It's the same with deception. Anyone can be deceived. Don't boast in your educational background, how many hours you pray, how big your church is, how much money you make, and God's blessing your business, your reputation for integrity. Don't deceive yourself. Get low before God. Continually ask him to search you and have accountable relationships.
It's The Line of Fire with your host, Dr. Michael Brown. Get on The Line of Fire by calling 866-34-TRUTH. Here again is Dr. Michael Brown.
Thanks, friends, for joining us on The Line of Fire, 866-34-TRUTH, for your health-related questions for Dr. Stengler. Remember, friends, when you visit vitaminmission.com, if you've never been there, do check it out as soon as you have a moment. Make sure today, tomorrow through the weekend, beginning next week, use the code HEALTH. Don't use the normal Dr. Brown code. That's 10% discount. But use the code HEALTH, capital HEALTH, for a double discount, 20%. Order big. Take advantage of the 20% discount while you can at vitaminmission.com. It's our joy to partner with Dr. Stengler as he partners with us. We want to see you healthier physically, and with each order, funds come back into our ministry to help with our work. So everyone gets blessed in the process. And Dr. Stengler gets to do what he loves to do, which is help people get healthier. Mark, I know you just wanted to make one more comment regarding mental health. So back to you, and then questions, then back to our calls.
Yeah, I was just going to say, in terms of mental health, like we see a lot of people with anxiety and depression. And so what my experience is people have mild to moderate anxiety, depression. A lot of these patients we can treat very effectively without pharmaceuticals. Patients that are more moderate to severe, yeah, they may need to be under, psychiatric care and be on medications for a period of time. But even in those patients, you work with their diet, you work with their lifestyle, replace their nutrients. It gives them more of an opportunity to not only feel good, but have the potential to get off those medications in the future. So it's all about balance. But, we use them when needed. Like I had a patient just a couple of days ago who was a fear of flying. She had to take a flight, so I prescribed a few pills of Xanax to use on her flight there and back, but not long-term because, we now know that Xanax is very addictive and it even increases your risk of dementia when used long-term. So when you use these things, you have to use them properly in a judicial way.
Got it. All right, just very quickly, and then I want to get back to the phones. You've really been very positive about quercetin as an important natural supplement. You were able to get it in stock. Last time we were talking, you were just getting it in. You found the right balance in terms of what to take on a daily basis or to up it during certain times. And folks, you can go to vitaminmission.com, check out quercetin while you're there, obviously with a Q. What is it that makes this so effective?
Well, quercetin is a very interesting, natural ingredient. You do find it naturally in foods, say like berries, for example, onions. And it's a powerful antioxidant. It's also powerful in reducing inflammation. So it does have studies on it showing it reduces allergies. So if you have allergies you're near, it's great as a natural antihistamine. It has anti-inflammatory effects. And what's been really big about it recently was last year there was 2 studies published on it, people who had COVID, and they were treated with quercetin. And in both those studies published in medical journals, people had significantly less number of days they were sick, and the intensity of the symptoms were reduced as well. So it was one of the few natural things actually studied when people have COVID. I'm not saying, people just treat their own COVID, but it's something you could take, with your doctor's supervision and see what's going on. So it's kind of exciting that way. So yes, I was able to get the one that the 2 published studies used from Europe, Italy actually, and that we do carry on the website there.
And then last time you were on with me, you raised concerns about how America was dealing with ivermectin, that you couldn't get it filled at pharmacies. And you're saying it's really kind of an unprecedented thing for the government to step in and say this drug, which is used widely with human beings successfully around the world, can't be used. Some time has gone by, a few months since then. Do you feel the same way? Is there anything that's changed your concern about the way this has been restricted or maligned?
Yeah, and I don't know if there's a, quote, federal law where pharmacies can't. It's just the mainstream pharmacies won't carry it.
Yep.
No one has said why, but we have to prescribe from compounding pharmacies, and we've prescribed it hundreds of times with good results. But no, it's like anything else. If something has, let's say, 50 studies on it, and it's something that's effective, then you should expect, maybe there's 35 good studies, maybe 5 or 10 negative ones, and 5 kind of so-so. And that's what you find with ivermectin. So last year in the American Journal of Therapeutics, in their July-August issue, which is very mainstream, they reviewed 15 trials using ivermectin for COVID, and they found it had moderate effectiveness. They found large reductions in COVID deaths using ivermectin. A more recent analysis of 78 studies found it to be effective. Statistically significant improvements were seen regarding mortality or death, ending up on a ventilator, intensive care unit admission, hospitalization, and recovery. So, it's just what drives me crazy when people say, oh, there's no science showing it works, this and that. I'm like, what are you talking about? We have, dozens upon dozens of studies, so that just isn't true. On the other hand, look, it's not necessarily a magic bullet. It doesn't mean you shouldn't get proper medical care and assessments and treatment, and maybe you need other things, but it certainly should be part of the consideration in helping a patient, and we prescribe it all the time.
Got it. Yeah, and just when people just repeat things, that's what always frustrates Nancy. We'll talk about it. Just online. They just science says this, science says this, and they're just repeating something they heard without really digging and looking into it. So that's what you want to do. Okay, let's.
Yeah, and I wrote an article on it, Michael. And I ended the article with a proverb, Proverb 12:15. The way of a fool is right in his own eyes, but he who heeds counsel is wise. People should get their information from various credible sources, not just one who maybe has a slant one way or the other. In my opinion, especially when it comes to health.
Absolutely. All right, let's go over to Brian in Pensacola, Florida. Welcome to the Line of Fire. Hello, Brian. Are you there?
Can you guys hear me?
Yeah, go ahead.
Yes, I'm here. Can you hear me? Hey, guys. Thank you for answering my call. So I've got just a quick little, not story, but just a little insight of what we're dealing with, and I wanted to ask about supplements on Dr. Stengler's website.
Go ahead.
So,
yeah, time is short, so dive right in. Yeah.
Okay. So my wife was recently diagnosed with cholesterol up into like 2.
Okay.
She inherited.
Yeah. What was it up to? You just cut out for 1 second. How high was her cholesterol?
Like on her LDL, just her LDL.
Okay, Brian. Unfortunately, I hate to do this, but the call is cutting in and out, and it's very difficult to hear you. So, Dr. Stengler, if you could just address in the larger terms cholesterol-related issues, that would be helpful. We've got maybe 2 minutes to do it.
Okay. Yeah, and I heard you said the LDL was 270, which is very high. Normal is less than 100 or less than 130, so that's very high. Cholesterol is just one factor amongst many when people have cardiovascular disease. not be contributing to cardiovascular disease, the studies show. I've done research in hospitals having heart attacks. 50 people, had normal cholesterol levels. So it is a factor, but it's not necessarily the factor. We do use products on the website like our cholesterol product, Cholesterol Wellness. We use a lot, helps with cholesterol. Our Bergamot Wellness has on it too. But what I do with patients, if they have high levels like that, or maybe there's a family history, I like to be more scientific. What I usually do is a screening test besides an EKG, coronary calcium score, and that is a CT scan of your heart arteries. Reflecting the plaque, or very, with the guidance supplements, or I'll refer to a cardiologist if I'm more concerned based on what some of their testing shows. I think nowadays doctors are not being scientific enough. Just because you have cholesterol doesn't mean you have a problem. Actually, cholesterol is very important in our body. It makes up our cell membranes. It makes up hormones. We have to have it. We're starting to see the opposite problem. People are getting their cholesterol so low, they're ending up with things like hormone deficiency, for example, which can affect you in many different ways. So it's better to do a more comprehensive assessment. Look at the state of your arteries. Are you forming plaque in there? If you are, yeah, maybe you need more, drug therapy combined with nutrition and exercise and all that. If your arteries are clear, or just mild amounts, you don't necessarily need to be on drug therapy. So I think most doctors, especially family doctors, are not being scientific enough when it comes to cholesterol, just putting in a category of being something that's bad when actually it has behind it. Due to diet, lifestyle, sometimes genetics, there are problems, and you may need medical attention. So you just have to dig to see what's going on.
Hey, Brian, thank you for the call. We just seem to have a couple of connection issues with calls being heard clearly. Yeah, look, the big word is being holistic, is looking at the whole person and the whole life and larger medical issues related, and often we're in a hurry to get things done. So, Mark, if there was one book, we've just got 30 seconds, if you could recommend one book of yours that would be helpful for someone to read to just get an idea of all this. Is there one in particular? You've written so many, but one in particular?
Yeah, definitely. I think it would be The Prescription for Natural Cures. Goes into diet, all the common conditions, how to address them integratively.
Got it, right. So that's Mark Stengler, The Prescription for Natural Cures. Hey, thanks so much for joining us, and thanks for being with me when I had COVID and giving me the advice I needed. Much appreciated. God bless.
Oh, thank you.
All right, friends. Great to have Dr. Stengler on with us, and may God's blessing be on his evangelism efforts this weekend. Let me just remind you one more time, when you go to vitaminmission.com, don't use the normal Dr. Brown code for the 10% discount. Use the health code, capital H, health. Use that for 20% discount on everything you purchase. Add that into a healthy lifestyle. These supplements could really, really benefit you. Wherever you are, they can be of help.